Let's move on to our next panel, which is the Comprehensive Metabolic Panel. So can you tell us about this one, Dr. Hanlon?
Sure. So this one is looking less at the actual blood cells, like white blood cells, red blood cells, the way that the complete blood count was. This one's looking at our metabolic panel, right? Comprehensive metabolic panel. So the different metabolites, the different electrolytes that are in our blood and circulating and are being filtered by our body. So in this panel, you actually get a really good, or the best that we have thus far, representation of our kidneys function and the function of our liver. And you can also look for signs of good nutrition, and I'll go into that a little bit. Um, but yeah, this, besides, the blood cells that are in our body, this also helps us to see if maybe there are other organs that are either functioning well or not functioning well. So I will just start at the top, and this is an example panel. Some panels will look slightly different, or these results will be in different order. But it's still good to just see a variety of panels. So this one starts with glucose, and that's, as we know, glucose is sugar. This is a measure of the sugar levels in your blood. Typically, someone without diabetes, someone with a pancreas that's helping to regulate the blood sugar in their blood, typically this number is below 100 and hopefully above 60. So as you can see here, it says that the range or the value for this patient is 88 milligrams per deciliter, and that the range over here on the right is somewhere between 65 and 99. So the glucose in your blood, really, this is just a snapshot in time. So at whatever time this blood was collected from this patient, their blood sugar was 88. If they had just eaten something right before, that number could be really high. It could be, 150, 200. It kind of depends. Or if they have been fasting, it could potentially be low. But typically, if you don't have diabetes and your body is able to regulate insulin on its own, typically this number should be somewhere in the 80s to 90s to 100 range, no matter whether or not you've eaten recently or not. The next two values, the BUN and the creatinine, these are both measures of kidney function. So BUN stands for blood urea nitrogen. And I'm not going to go into exactly what that is, but it's essentially a breakdown product of the hemoglobin that we talked about earlier. And it's something that your kidneys are responsible for filtering out of your body. And then the creatinine is simply put a measure of the function of your kidneys. So the kidneys are something that take your blood and they filter your blood, and they take all the extra things that are in your blood and they put it into your urine. So they're essentially one of the main filters of the body, regulating all of our electrolytes and everything else in our body, really. So the BUN and the creatinine are very important in measuring kidney function. If the BUN and the creatinine are high, that's when we start worrying about either the kidney has been injured in some way or there's some chronic damage being done to the kidney. So there's not really, I can see here, there's a range of values. We don't usually worry too much if they're really low, but we do start to worry if these numbers are high, because it shows us that there's a high level of the BUN and creatinine in the blood, and it's not being properly filtered out through the kidney, which is why it's staying high in the blood. The next thing I'd like to talk about, the EGFR and the BUN creatinine ratio, we don't really need to go into that at this time. If you have more questions about it, you're welcome to reach out to me. It's again a measure of the kidney function. For the sodium, potassium, and chloride, carbon dioxide, calcium, these are all electrolytes in your body. Really, in the context of the doctor's office, the only one that would be like something to really be an emergency or notify the doctor right away is either if the potassium is like super high, like above 5.5, or if the sodium is very, very, very low, like 130, 120, something low. But again, the computer usually will sort of alert you if something is really high or really low. That's not something that you will have to necessarily identify or notify the doctor. The doctor or whoever the provider is will see that and will act accordingly. But just something to be aware of. Typically, the potassium and the sodium are kind of the most important of these electrolytes. Just in terms of your body's function, if they're kind of really too high or too low, it can affect your heart, it can affect your kidneys, it starts affecting other organs. So that's why they're important to have sort of in normal range. The protein and the albumin we often use as sort of a surrogate or a way to note if someone is having some malnutrition. So if you're not getting a lot of good nutrition, your albumin, which is just a type of protein, your albumin might be low because your body's not able to make enough of it because you're not eating enough proteins that you need to make the albumin. And then similarly, the globulin, that's a type of antibody, a bit outside of the scope of this lecture. The last four values here, so bilirubin, alkaline phosphatase, AST, and ALT, those are all liver tests. So if those are high, sometimes that can indicate liver injury, or it can indicate some sort of dysfunction or obstruction within the sort of liver gallbladder system. So I guess big takeaways from this, the BUN creatinine, those are for kidney. The bilirubin, alkaline phosphatase, AST, ALT, those are liver tests. And then the rest are electrolytes and proteins in your body.